patients often ask whether liposuction will achieve their goals versus having a lift, such as a tummy tuck or an arm lift or a thigh lift. So let me try and explain what most people probably already know but don't really think of very seriously as the differences between achieving the result with liposuction and body contouring versus a lift. And we'll talk specifically about an arm lift or a tummy tuck or a thigh lift versus just doing liposuction. Well, it seems pretty clear to most surgeons that what we look at when we see patients is whether the skin tone is such that if we deflate the skin by taking fat out, that the skin will look good enough, even though we make someone smaller, that they'll be happy they did it. So basically, if this is the muscle and this is the skin and the fat is in between, the way liposuction of course occurs is a tiny incision about the length of my fingernail is used in the skin to insert a tube that suctions the fat. And nowadays there are many techniques to do liposuction, but traditional liposuction, which is a stainless steel type tube, typically of a small caliber, 2 to 3 millimeters, is used to gently suction the fat out of the space between the skin and the muscle, always leaving a little fat so the skin looks smooth without wrinkles and ripples from the standpoint of you haven't taken too much fat. But then you still have to determine whether the skin elasticity will allow the skin to look good once it rebounds and deflates. So the techniques are, there's laser liposuction, which uses a laser tube to go into the skin to vaporize the tissue, but you still have to use a traditional tube to suction the fat out. There's ultrasonic liposuction, which is an ultrasound tube that sends sound waves into the tissue and also tends to liquefy the fat, but you still have to put a traditional tube to take the fat out. Most surgeons who do a tremendous amount of liposuction still use the traditional liposuction cannula to suction the fat out, even though they may use occasional techniques of laser ultrasound. The key is using a small enough tube that you can control the fat removal so it's not removed so quickly that you have irregularities, which should be very uncommon. Then you have to determine, if you do remove the skin, whether it's from the arm or from the abdomen or the thighs, whether you as a patient would have an improvement that would be acceptable based on whether your skin will shrink. Again, you can't emphasize enough, that is the critical decision process. In the abdomen, for instance, in women who've had children, many times the skin simply won't rebound, especially if there's some stretch marks or looseness. And if the expectation, and that is the key, what is the expectation? If the expectation is for the skin to be smooth and flat and tight, and you already have a little loose skin, then liposuction of the abdomen will never achieve that. And that's when you will have to consider removing the skin with an incision to tighten the skin. No one would want that, but if that's the only way to get to your point A from where you are, then that's what you have to do. Examples of liposuction that work beautifully are patients who have relatively firm skin, even though they may have significant fatty deposits. For instance, let me show you these. This is a patient who's had liposuction only, and the benefit is that her skin tone is such that it's made a tremendous difference in her clothing size, and her skin still looks appropriate because it was so firm. A judgment made by the surgeon by examining the patient. A patient whose tissues are a little bit looser and a little older, but nevertheless a significant improvement, because again, the assessment of the skin tone is what matters, and we knew that this patient's skin would likely redrape, and so she lost almost 3 pant sizes just from liposuction. So in summary, you want to know what kind of result you want, and then you need to make sure you and your surgeon are on the same page of whether that result can be achieved, whether it would be just with liposuction, which has obviously a less of a recovery with smaller incisions, versus a lifting procedure where skin is either removed from the arm, from the tummy, or the thigh. So I hope that helps you know how to approach this, and in all cases, if you have any concerns, get a second or third opinion.